Okay, we go through tuberculosis, which is one of the major conditions that are affecting the respiratory system. So I'm sure you went through this condition, and it's one of the most simplest condition that is easily understood. So now I want us to look at the specific objectives, where we'll look at the definition for tuberculosis, the classifications for tuberculosis, the predisposing factors to tuberculosis, the pathophysiology, the signs and symptoms, management and complications at last. So this is how we're going to carry out our work. So now, before I go to the definition of tuberculosis, we start with the introduction. So we now try to look at the respiratory system, the anatomy and physiology of the respiratory system. So looking at this diagram, of which we have to understand to say the respiratory system starts from the nasal cavity, from the nose. As we inhale, we take in air in form of carbon oxygen. We take in oxygen, then again we move out it in form of carbon dioxide, and in that way. So now we need to understand that from the nasal cavity, we have the pharynx, we have the epiglottis, we have the larynx, we have the trachea. Again, in the trachea, before you enter into the lungs, or before the trachea bifurcates into the bronchi, is at the carina there, it you need to understand to say it enters into the lungs, and the structure of the lungs, if you've seen, it is more like surrounded by the pleural space, or the pleural cavity, which is just covering the lungs. And also in the pleural cavity, that's why you're going to find some fluids that also helps the movements of the lungs in terms of expansion. So from there into the lungs, as the trachea bifurcates, the bronchi are then formed, the right and the left bronchi. There we have got the diaphragm there. So all these structures are just helping an individual to perform the respiratory function, to breathe in and out. So if you try to look at the bronchi specifically, we go deep. This is what we're talking about, the bronchial. If you've seen, it has got a lumen, a bigger lumen. I'm sure you can see that it has got a bigger lumen, of which joins into these sacs that you are seeing as alveolar sacs. So these alveolar sacs are the one that you are going to see that they are the one that plays a major role in oxygen or exchange of gases. Then we've got the alveolar macrophages. Alveolar macrophages, if you can see from this diagram, so these macrophages are the white blood cells that are found in the lungs, that helps in the immune system or immune response. So now you need to understand to say the other thing to understand is in the alveoli, like I said, it is where oxygen or gaseous exchange takes place. So now, why did I come up, or why did I want us to look at these structures? It is for the purpose of understanding what is really affected in tuberculosis. What is going to happen if at all an individual has tuberculosis? Since in the pathophysiology, we are going to hear where the bacteria goes. So now, before I move on to the definition, you need to understand one thing to say. The causative organism for tuberculosis has got some properties, and one of the property that is most cardinal to us is an aerobic or an aerobe, which means the tobacco bacilli survives in the presence of oxygen. Hence, when it enters into the lungs after you inhale, when it enters into the lungs, it settles in the lower aspect of the lung, which is the alveoli, where gaseous exchange takes place, because it needs a lot of what? Oxygen. That's why I had to come up with this diagram, so that you see specifically that is about how the microorganism enters into the lower aspect of the lungs and also impairs gaseous exchange. But we are going to understand that nicely in the pathophysiology. So now, Let's try to look at the definition for tuberculosis. As we say, it is an infectious respiratory condition that is caused by a Mycobacterium tuberculosis that is transferred through inhalation of an infected cough spray that is characterized by night sweats and coughing for more than 2 weeks. So in your definition, talk about the system that is affected, of which you said an infectious respiratory tract condition that is affected by which organism? The tobacco bacilli. How? By inhalation of an infected cough spray. If an individual is seated or is in an environment where there is someone who is coughing, if the person who is coughing has TB, it's easy for that person to transmit TB to the other person, and then the condition will come in, and these are the characteristics that will be there. So night sweats has to be there, has to be part of your signs and symptoms or your characteristics of tuberculosis. Coughing for more than 2 weeks has to be also prominent and has to come out. So for you to get the all 5 marks is just to go with the same definition, of which includes the causative organism, the mode of transmission, the system affected, the characteristic, and also, yes, if the characteristics, then you get it. So that is the definition for tuberculosis. Simple. So when it comes to the classifications, how do we classify tuberculosis? How do we classify tuberculosis? So you need to understand to say tuberculosis, the way it starts specifically, it affects the respiratory system, like we said in the definition. It affects the respiratory system where it goes into the lungs. So the classification, other classifications will come in as a result of these infections, or the immune system fail to combat the infection and they spread to other parts of the body, causing different types of tuberculosis. So the first one we are saying, tuberculosis can be classified according to the area that is affected, like I said. If at all it is the lungs that is affected, if at all it is the spine that is affected, the abdomen affected, or the whole body affected, it is going to have different names. So if the lungs that are affected, we are going to call that as pulmonary tuberculosis. It will be known as pulmonary tuberculosis because it has affected the lungs. Again, we've got TB arthritis or tuberculosis arthritis that affects the joint. So TB that is going to affect the joint is known as arthritis tuberculosis. Yes, so this is how it is going to be classified. So in other terms or in other sites, if the TB or the tuberculosis affects the spine, we are going to call that as tuberculosis of the spine. If at all it affects the abdomen, we're going to say tuberculosis of the abdomen. But if at all it affects the whole body, we are going to call it as the miliary tuberculosis. It affects the whole body. So that's how we are going to classify tuberculosis. We classify according to the parts of the body that are affected. If at all it's the lungs, we're going to call it a pulmonary tuberculosis. And this one is the most common type of tuberculosis. We move ahead. So we talk about the predisposing factors now. What are the things that may put someone at risk of having tuberculosis? So the first thing is being found in crowded places. So this makes a person to be exposed to people with TB, hence getting infected. So if at all an individual is in an area where there is tuberculosis or endemic place of tuberculosis, and then they happen to be near that person who has tuberculosis, and that person coughs out and they inhale the infected cough spray, the chances of that individual to contract tuberculosis are very high. Talking about occupation as well, so some occupations may also increase the risk of someone to have tuberculosis, such as the health workers. So if we talk about the health workers, you look at the setup of the people that are found in the hospital. What do they do? What duties do they perform? Let's talk about the times of COVID-19. The people who are mostly affected or mostly susceptible to have COVID-19 are the people who are attending to those patients. Same with tuberculosis. The people who are attending to the nurses or the doctors who are attending to those patients who have tuberculosis have a higher risk of getting tuberculosis than those who are not attending to those people. So also have mine industries. So in mine industries as well, you're going to find that some chemical substances such as silica may also predispose someone to have tuberculosis. Malnutrition, again, malnutrition can also be a predisposing factor to tuberculosis. This is because the person has a reduced immunity, hence susceptible to TB. So that's why it is important to have a good and proper balanced diet, so that your immune system may be strengthened or enhanced. So if at all your immune system is low, it is very easy for you to have or to contract an infection or any other infections, because your immune system is low, your defense mechanism is low, hence being predisposed to different kinds of conditions. Talking about HIV exposed people. So for those who have got HIV and AIDS, how are they predisposed to tuberculosis? It is because of what? The reduced immunity, weakened immunity. So a patient with HIV infection may have an weakened immune system, hence you find that they are predisposed to tuberculosis. Lack of proper health services as well. Lack of proper health services. Don't leave out this one. Lack of proper health services. So those people who do not practice good health services, such as taking their children for vaccination, such as BCG vaccination to prevent tuberculosis, you're going to find that the risk of having tuberculosis is very high. That's why the predisposing factors should stand as a guide to your preventive measures, to your IAC. How can you prevent tuberculosis? So just go with the predisposing factors that you had. Being found in crowded place, standing as a predisposing factor. Turn it around. How are you going to make it as an educational aspect, a prevention? That's the first point you can have. Occupation, again, how are you going to make sure that you prevent tuberculosis in an occupational area? Malnutrition, how are you going to combat this malnutrition for you to prevent? HIV exposed people, how are you going to make sure that you enhance their immune system to make sure that you prevent? Lack of proper health services, what are you going to do? What IEC are you going to do in order to make sure that you enhance the knowledge of these people on the proper health services and hence preventing tuberculosis? So predisposing factors should give you a hint of the preventive measures, because you know how they are coming about. We move on. We look at the pathophysiology now. We look at the pathophysiology of tuberculosis. So the pathophysiology or the physiopathology. So pathophysiology or physiopathology just talk about the normal functioning of the respiratory system, and also the pathology, which we have an infection which has come in, there's an alteration in the functioning. So if we try to look at the normal function of the respiratory system, like I said earlier, the normal functioning is just for gaseous exchange. Gaseous exchange. The mucosal membrane of the respiratory system is kept intact. So now, in cases where there is an infection, in cases where there is someone inhales the tobacco bacilli, you are going to find that there will be alteration in the functioning of which we are saying of gaseous exchange will be impaired. So now let's try to go through. So the infection follows the inhalation of an infected cough spray. When the microorganism gains access to the body, it settles in the lower parts of the lungs. So once you inhale an organism, specifically the tobacco bacilli, you are going to find that it will travel from your nose up to down and goes to settle in the lower parts of the lungs. And that lower parts of the lungs, that's why I said we are going to find the alveoli where gaseous exchange takes place from. And I said one of the characteristics of the tobacco bacilli is it is an aerobe, hence it goes specifically where there is high concentration of oxygen. So while in the lungs, they are going to stimulate the release of pulmonary macrophages that engulf the bacteria, forming a foreign body granuloma. So immediately it just settles in the lower aspect of the lungs, our immune system senses and sends the soldiers, which are the macrophages that I said, alveolar macrophages, and these are going to engulf it. More likely, they are going to put it in a cup, they are going to hold it, put it inside, enclose it inside. So where there will be now formation of a granuloma. So these are the stages. So if you don't want to forget, just take them as stages. The first thing, you inhale an infected cough spray containing the tobacco bacilli. From there, it travels and goes to settle in the lower aspect of the lungs. After that, it stimulates the release of our body's defense mechanism, which are the macrophages that are going to engulf it. After that, the bacteria are not destroyed but continue to multiply until they eventually break loose. So after the inhalation, or after those organisms stay settle in the lungs, it's not like they've been engulfed. They're not going to be killed. No, they are going to be engulfed there. Multiplication will continue, and after a period of time, they are going to break loose and go to affect other parts of the body. So one thing you need to understand to say, in the pathophysiology specifically, we have the inflammatory process, or the inflammation process. So this inflammatory process, we do understand how it comes about. There is swelling. This swelling that will cause now seepage of fluid from the intravesicular spaces into the extravesicular spaces. That's why you're going to find that there will be a lot of accumulation of fluids there. The mucosa membrane is going to be disturbed. That is going to cause what? Production of thick or viscous mucus. And that's how these signs and symptoms are coming in, such as cough for more than 2 weeks. This cough is trying to expectorate the mucus, thick mucus that has been secreted because of the destruction in the mucosa membrane. Chest pains will come in as a result of an inflammatory process or reaction in the body, and also some rupture of the blood vessels that are there. That's why you find that there is also going to be coughing of blood, which we call as hemoptysis. Then you also have dyspnea, which is difficulties in breathing because there is a destruction in the gaseous exchange, and there are a lot of fluids in the lungs or in the respiratory system that are making gaseous exchange to be impaired. Joint pains will be there because of gaseous exchange impairment, because we do understand to say blood supply has to be running, as we know that blood carries oxygen. So if there is cut in the oxygen supply to the other parts, there will be fatigue. Night sweat also has to be there. Where you're going to find that as there is an increase in the metabolic reaction in the evening, you find that someone will be sweating. So we continue. At this stage, the bacteria spreads to different organs. So as it breaks loose, the organism now spreads to other parts of the body, causing extrapulmonary tuberculosis. It is going to affect other parts of the body. So, and thereby stimulates the release of blood-borne phagocytes which contain the infection. So with good immunity, the disease is contained and the patient may not present with any signs and symptoms. But if at all there is a lowered immune system, the signs and symptoms are going to be manifested. So that's what we are trying to talk about. So, but with the lowered immunity, the patient presents with signs and symptoms of tuberculosis, such as night sweats and coughing for more than 2 weeks. So, though that is the pathophysiology, simple pathophysiology, just steps: inhalation, settles in the lower parts of the lung, macrophages come in, engulf it, multiplication, break loose, go to other parts, affects gaseous exchange and also metabolic rate. Then you're done with the pathophysiology. Signs and symptoms already talked about in the pathophysiology. So there is cough for more than 2 weeks, that is due to irritation in the respiratory tract. There is night sweat, that is due to increased metabolism at night by the bacteria. Fever that comes in as a result of bacteremia, which is the presence of a bacteria in the bloodstream. There is also going to be weight loss, that is due to anorexia. So anorexia will come in as a result of alteration in the GIT and the central nervous system, specifically in the site or the center of appetite. Hence, an individual are going to have loss of appetite, which will lead to weight of loss. Like I was telling you last time, I don't know if you remember, from the signs and symptoms that you have, you can formulate a nursing care plan. You can formulate problems for the nursing care plan. for the same cough, for the same night sweats, for the same fever, for the same weight loss, what problems would come in, would result from these signs and symptoms that you are having? You form a problem from there. Chest pains, that is due to inflammation in the lungs. Other problems as well. Dyspnea, that is due to impaired gaseous exchange. Another problem can be formulated. Cyanosis due to tissue hypoxia. Like I said, there is impaired gaseous exchange. Hence, tissue perfusion is going to reduce. There will be blood-stained sputum, that is due to erosion of the blood vessels in the lungs. That will cause someone to be coughing out sputum that contains blood. So those are the signs and symptoms. If you're asked to write about 5 or stating them, that's how they come about, then you get it right. So now, these are the signs and symptoms as you've seen. There is fever, there is night sweats, there is persistent cough, blood phlegm, and chest pain or shortness of breath. So those are the signs and symptoms that we have. So now we talk about the management. So from where we are coming from, which means if you've been given a question, the first question is the definition, you get the 5 marks. You get the signs and symptoms, which are, maybe they tell you to state 10 marks. From there, we talk about the pathophysiology, which is supposed to be 20 marks. You get it now. You now go for what? The medical management. Sometimes the question may give you the signs and symptoms or a scenario, and it will ask you to give a diagnosis from what we are going to say here. So, medical management, as we know, we've got we'll start with the investigation that we do. First investigation that we do is the history taking, which always has to review the onset of the condition, the signs and symptoms. We need to understand that history taking is what gives us the information about the patient. Hence, we rely on the patient's information. Physical examination we are going to do on examination will show cervical lymphadenopathy. So when you do more like palpation in the cervical region, just below the cheeks, or the cervical region itself, if you understand it like that, you're going to see that there will be lymphadenopathy. So in tuberculosis, you have to understand to say there will be lymph nodes. Lymph nodes will be visible due to the immune system trying to respond to the infection that has come. So the organisms have been contained in the lymph nodes. So as you try to palpate the lymph nodes, you find that they will be there. That will be lymphadenopathy. Then sputum for AFB to confirm the diagnosis, or sputum for gene expert, which is the laboratory investigation done to rule out or identify the organisms that are found in the sputum. Chest X-ray, most important as well, will show infiltration in the lungs. So infiltration of the lungs, this is what we're talking about. So from the left side of the lungs and to the right side of the lungs. So if you see on top, we have the normal X-ray scan of the lungs, and then at the bottom there you've seen that there is infiltration here. There is infiltration here. So you're going to find that more like, instead of the lungs being viewed completely, but there is something that has covered the lungs. So that is what we are calling as the infiltration of the lungs. That is on X-ray. So blood for culture will also show the causative organism as well. You can do that. You can do FBC, the erythrocyte segmentation rates, which will be elevated. So those are the investigations that you can do. So now, what is the medical management? What is the medical management for tuberculosis? So tuberculosis, understand it, we use the 4 FDCs. The 4 FDCs, which are the 4 fixed drug combination. And then we have to understand to say the treatment of tuberculosis is in categories. There is category 1 and category 2. So for category 1, you have to understand it is for the new cases. The patients who have just newly diagnosed with tuberculosis, we use category 1. And this category 1 has got the duration of 6 months. 6 months. So we've got the intensive phase, which lasts for 2 months. The continuation phase, that lasts for 4 months. So total, which gives us 6 months. 6 months. So now, how do we administer these same FDCs, the tuberculosis drugs? So you need to understand to say we have to consider the body weight like it has been stipulated there. So you just follow the table for the treatments. So that is the category 2 for retreatment for those who were treated once, then they come back with new they are confirmed to be having tuberculosis again. That is mean that you give. So same as in pediatrics, just look at the table. We've got intensive category 1 and category 2, same intensive phase and the continuous. So these are the drugs that you're supposed to consider in tuberculosis. That is category 2 for tuberculosis. So the other supportive drugs that you can give, there's vitamin B6, which is 50 milligrams OD to counteract the effect of isoniazid. So look at the side effects of these FDCs or anti-tuberculosis drugs. Look at them. Most importantly, also add the painkillers because of chest pain that is there. Fluid therapy for rehydration, you have to understand it's there because there is the diaphoresis, which is loss of heat or excessive sweating. There's also oxygen if indicated. If at all there is increased the tissue hypoxia, rest and diet most importantly. So the management that you are going to give specifically, we are going to consider the general management, but make sure that you consider the specifics such as isolation of the patient, talk about hygiene, talk about nutrition, specific nutrition that you are going to give in the IC, then you get it right. So like I mentioned to say, the nursing problems may arise from your signs and symptoms, and these are the ones that you may find. There'll be fever, but it's not going to be written as fever. You write it as the altered thermoregulation. So I'll just end from here, and it will be more like an assignment. You just you write the nursing care plan for tuberculosis. You write it on your free time. In your free time, you write it. Then try to compare with the one that is already there. Then see how you are going to write it. But specifically, follow the pathophysiology. Look at the signs and symptoms that it has produced, and then you consider the problems that you've written, if at all they are matching with what we've discussed. So this is the tuberculosis.